Hi, I'm Jeffrey Zonder. I'm one of the multiple myeloma docs at the Karmanos Cancer Institute in Detroit, Michigan. And today I'll be talking about a brand new myeloma therapy, Lynozyfic. Lynozyfic is the brand name for linvoseltamab, and sometimes you'll hear physicians or researchers refer to it as Limvo. It's one member of a brand new class of therapeutic agents called bispecific antibodies. There are two other bispecific antibodies that have the exact same target on myeloma cells as Limvo. One of them is Elrexfio, which is the brand name for elranatamab, and the other one is Tecvayli, which is the brand name for teclistamab. Again, same target on the myeloma cells, same target in the immune system. Linvoseltamab is approved for patients who have relapsed or refractory multiple myeloma. That means multiple myeloma that has stopped responding to prior therapy. And patients have to have had at least 4 prior lines of therapy that include the usual medications that people get in the first or second line of therapy, actually, in most cases. The nice thing about bispecific antibodies is that they don't require an awful lot of planning. Once you decide that you want to use them, you can just go ahead and start using them without much waiting. Another example of an immune therapy in this space is CAR T cells. Fabulous immune therapy, but it requires planning and preparation. Now, linvoseltamab is given as an IV infusion. When we start linvoseltamab therapy, we start with something called ramp-up dosing, which means the first week we give a very small dose. The second week we give an intermediate dose, and the third week we give a full dose. And then we give weekly full doses after that. These first doses are generally followed by a brief hospitalization, usually as short as a one-night overnight stay, and that's just for close monitoring to look for certain toxicities. After that ramp-up period, patients are treated as an outpatient, and also over time, it may be possible to go from weekly dosing to every 2-week dosing and eventually even every 4-week dosing, which is a lot more convenient. Now, in terms of the side effects that we're monitoring for in that early part, the two biggies are something called cytokine release syndrome, or CRS. These are flu-like symptoms, fevers, chills, sometimes low blood pressure, sometimes low oxygen. And then the other one is neurologic side effects. You might hear your doctor refer to those as ICANS events, and that could include confusion, lethargy, and sometimes it can be more severe than that. We're very good at managing these, and it's highly likely that these side effects aren't going to be very severe because we manage them easily. We give pre-medications to try and prevent them from happening in the first place, but if they do happen, we're able to jump in with medications quickly, and we can usually get them to resolve uneventfully. Now, later, after that first 2 weeks, the main side effects that we're really focused on have to do with low blood counts and immune suppression and infections. All patients are given preventative agents to try and reduce the risk of infections, and that includes antiviral therapy like acyclovir, antibacterial therapy like Bactrim, or pentamidine to reduce the risk of certain respiratory infections. And many patients also need IVIG, which is like an infusion of antibodies on a regular basis to help boost their ability to fight off respiratory infections. So how can patients and their caregivers help make sure this all goes smoothly? But the first thing is the decision to start linvoseltamab or any bispecific antibody should come after a thorough discussion between the patient and the caregiver and the treating physician, because the decision about whether or not bispecifics are right for you have to do with sort of a balance of the efficacy of a therapy, the side effects of a therapy, and then other things like your lifestyle and the logistics of the therapy. Also, communication from the caregiver is very important. Remember, I mentioned one of the early side effects can be neurologic side effects, and sometimes patients don't recognize that they're having a problem, and the caregiver in that early period is the one who may be the one who communicates with the physician. All of this said, I think what I think my take-home message for patients is that linvoseltamab, Lynozyfic, and the other bispecific antibodies are an important, really groundbreaking new part of the armament, of treatments for multiple myeloma. They have very high response rates, even in patients who've had a lot of prior therapy. The responses are often fast, high quality responses, and often very durable. All of us who have experience with these antibodies have seen patients with responses measured in years, and that's really a change for patients who've had as much therapy as 4 lines of treatment or more. So you can get a summary of this information either through the MMRF or at Regeneron's support services site for Lynozyfic. Regeneron makes Lynozyfic, and that's www.lynozyfic.com. Thanks so much.